Cabinet Press Briefing. We're talking health this morning, and we have with us the Honourable Minister for Health and Social Security, the Honourable Nicholas Steele, as well as the Acting Permanent Secretary, Dr. Francis Martin, of course, doing a COVID update and other matters pertinent to the Ministry of Health. Without any further ado, I will hand you over to the Honourable Minister. Good morning.
Good morning, Leslie Ann. Good morning to all of our viewers and listeners out there. This morning, happy St. Patrick's Day to everyone. This morning, we have an update. There are a total of 154 cases of COVID-19 since the start of this pandemic. We currently have 2 active cases. These are travelers in quarantine, one who traveled to Grenada from Jamaica, and the other traveled to Grenada from the US. These individuals are being monitored at this point in time. They are not displaying any symptoms, but will be observed by our health officials until they are medically cleared. We have conducted 23,450 PCR tests to date, as well as inoculated 8,764 individuals with the first dose of AstraZeneca vaccine. Let me go immediately into some of the social media or mainstream media issues that have been circulating with respect to the AstraZeneca vaccine, and some countries suspending or pausing the issuing of that vaccine. We, including CARPHA, Ministry of Health Grenada, and the entire OECS islands, are subscribing to the WHO policy and Pan American Health Policy, as we have from day one. According to the WHO, Pan American Health Organization, as well as the European Medical Authority, which is the very entity that will decide on the efficacy of vaccines in Europe, they are saying that 17 million individuals have been vaccinated in Europe with the AstraZeneca vaccine, and a total of 40 individuals have had a form of blood clotting. And in the European Medical Association, as well as the WHO, clearly they are saying that if you were to sample 17 million people not vaccinated, you would actually get a higher frequency of that same blood clotting, so that they see no relation between being vaccinated and those blood clots. So as a result, we, like the rest of CARICOM who have AstraZeneca vaccine, and the rest of the world, UK included, continue with the vaccinations of using AstraZeneca vaccine. I want to touch also on recent developments that we are seeing, for instance, in St. Vincent, and we support this idea, and it is a discussion that we need to have, where St. Vincent is saying that, for instance, their bus drivers, if they are not vaccinated, that they will continue to have the reduced amount of passengers in their buses. Discussions are also being had with respect to frontline hospitality. For instance, the ministry believes that it is a valid discussion to have, that the quarantine sites that we are using, that all individuals who are working at those quarantine sites should be vaccinated. And the same discussion can push forward with respect to supermarkets, banks, and as St. Vincent is saying as well, buses. We're all saying the same thing. Those of us who are involved in frontline work, which is medical or hospitality, should be vaccinated. Otherwise, we are putting ourselves and the nation at an unreasonable risk. So having said that, I open up to questions from members of the media. I think Dr. Martin, you'd want to give some comments if you wish to. Thank you.
Thank you very much, Leslie, and to the listening public. I do not have a whole lot to say. I believe this is a situation where we should be answering as many questions as we can from the public, except to say that I'm encouraging people as much as possible to continue the work that we have started and build on the successes that we have gained so far by taking us to the finish line, and that means using the vaccine or taking the vaccine so that we can get to the finish line as quick as we can.
Thank you, Honourable Minister and Dr. Francis Martin. So, colleagues, there we've heard it. The floor is now opened for questions. Anybody ready with their questions as yet? While we wait on our colleagues, maybe, Minister, maybe you can, I know based on what is happening in St. Vincent, some people were asking if the bus drivers are being vaccinated and then some of the passengers are not yet vaccinated, what, how does it balance off?
Well, we want everybody to be vaccinated. What we're saying is we want everyone to be vaccinated. But what we're saying is individuals who are interacting with more persons in the public than the rest of us. So I will get on a bus, but I will only be on that bus with the individuals for that trip I make, whereas the bus driver and the conductor is going to be on the bus all day, picking up everybody that they pick up. So they are putting themselves at a much greater risk, and as such, they should be vaccinated in order to ensure their safety and the safety of all of their passengers.
Okay, thank you very much. Nancy Maguire, good morning. Are you ready with your question?
Yes, I'm ready.
Okay, go right ahead. We're hearing you.
Do we have any idea of the number of doses that we've already given as to the makeup of who those people are? Are they people, frontline workers? Are they people over 65? My second question is, how many vaccinations do we now have available, and how pleased are you with the number that have been vaccinated? I have one more question, if I may. Could you provide an update on the status of the COVID-19 Response Support Fund that was established last year for people to donate that want to support? Thank you very much, and happy St. Patrick's Day.
Nancy, let me let Piers answer the last question first, and maybe we can proceed.
I thought you were going to answer the last one.
Go right ahead. The last one is with respect to the COVID fund, the donation fund. We keep accessing, and persons do keep depositing or putting money in. So there is a constant accounting through Ministry of Finance and the Accountant General as well on the use of those funds.
In relation to the demographics of those who have received the vaccine, of course we don't give it to persons less than 18 years, but we have a higher percentage of persons in the adult and elderly population, including over 65, that have received the vaccine. It's available to the young persons, young adults as well. We hope and wish that more of them are going to come through. We're seeing a number are coming through, but as far as the demographics are concerned, it's the adult and elderly population mostly. And of course, reasonably so, because they are at increased risk based on their comorbid conditions and by virtue of the fact that they're in that population.
All right. Good morning. GBN, are you there?
Yes, good morning.
Go ahead.
I have two questions presently. One, Minister, could you clarify something for us? We received reports that a young man died a day after taking the vaccine, and I believe he died yesterday. Could you clear the air on that? And I know that it is important to have all frontline workers vaccinated. Now, understanding that government still has the vaccination process as a choice, meaning that it's not mandatory, would that change for frontline workers, or should I say is government considering changing that for frontline workers?
Let me ask you a question on that first thing. You said a young man died. From what? And I think if you are able to answer that, you may find the answer to your question. So there is no death associated with vaccination not just here in Grenada, in the entire Caribbean, and with the use of AstraZeneca. There is no death associated with that vaccine. With respect to mandatory, as Minister of Health, and I am sure most, if not all, of my senior team at the Ministry of Health charged with the protection of individuals from COVID-19, we would like to see it mandatory. But we also need to respect the freedoms of individuals. However, there comes a time where certain measures have to be taken to protect the majority of citizens in Grenada. And that if individuals, in their exercising of their freedoms, put the rest of us at risk, then the question needs to be asked as to, do they have a right to put the rest of us at risk?
All right.
I mean, I want to add something, sorry, not add, but when I entered the medical fraternity, it is mandatory that a young doctor must have certain vaccines because of the risk of accidentally or otherwise passing on an infection to a sick person. And so many universities would ensure that all young doctors are are vaccinated. And I'm hoping that that kind of information would resonate well with our senior colleagues, our medical colleagues, to understand that while we do believe in the virtue of freedoms, that the fact that you have taken this oath to protect the lives of others that you serve, that you're going to do the correct thing and protect them by protecting yourself as well from the vaccine. And that was just something out there for my medical fraternity.
Thank you very much. Linda Straker, good morning. You have questions?
Yes, good morning. I do have questions. Good morning to you and Minister Steele, as well as Dr. Martin. Actually, my first question is a follow-up from what Rena asked. Minister or Dr. Martin, can you tell us whether or not, now when we listen to news internationally, we would have heard of someone dying from blood clots, and then it was eventually discovered that that person had pre-existing condition, what really had them die. In the case of Grenada, what Rena raised, is there any evidence that someone would have passed away within a short period, a couple of days after taking the vaccine? And my other question, I was told that I should ask two at a time. That was said to me. After 1 year, we would have received notice on the 22nd of March last year of the first case. We are almost approaching 1 year date to date, but it's what are the lessons that Grenada has learned with regard to what is happening in the pandemic? And would you share with us the worst medical condition that was developed? What was this condition, and how they were treated over the years, over the months? Sorry.
Let me address that question again with the asking if anybody died from the vaccine, and the answer is categorically no. There is absolutely no evidence of anyone in Grenada or anywhere else dying as a result of the vaccine. Now, let me be clear on this. The vaccine does not give you immortality. It gives you immunity to COVID-19. So that doesn't mean that after receiving a vaccine and both doses of the vaccine, that someone doesn't die from something else. But it is not, definitely not, from or as a result of taking the vaccine. The other question I'll leave to Dr. Martin.
So, Linda, over the year of us dealing with COVID, we were I mean, I don't want to say lucky, maybe blessed is the better word. We were blessed in the sense that we saw no serious untoward medical conditions emanating from COVID. The admissions to the ward of the 5 patients that were infected with the COVID, actually, a couple of them had respiratory issues related to what we normally expect from COVID. But the others were really maybe the psychosomatic symptoms or the psychological symptoms and the stress of knowing that you have COVID and then having hypertension and diabetes and those chronic conditions led to that level of stress causing the cortisol in your body to rise. And as a result of that, you actually feel sick, you actually feel unwell. And they got admitted for that reason. Some of them had respiratory symptoms consistent with that of COVID, but no significant medical condition emanating out of, let's say, you guys remember the days of chikungunya and Zika where we had Guillain-Barré syndrome that came out as a result of the virus being infected in the body. We did not see this in this particular instance of COVID. We predicted at the beginning that it was going to be very mild symptoms, and 1 year later, that is what we have seen. No serious conditions emanating out of it.
Linda, do you have any other questions at this moment?
Other questions?
You have another one?
Yes.
Go right ahead.
Yes. Recently, I went to two business places and I no longer had to do contact tracing, putting that information in a notebook. Can you tell us whether or not that protocol has changed? When I asked why, I was told I've been picked up on camera. A camera will not pick up my contact details number. So can you tell us whether or not that has changed? And if it has changed, how are people going to be contacted in the event that they need?
Linda, no, the policy has not changed, and if offline, when we are finished, if you can let me know the names of those establishments so we can pay them a visit and remind them of the protocols.
Thank you, Linda. GBN, you have a follow-up question?
Yes, I do. I would like to know, as it relates to the availability of other vaccines, how soon will we see other vaccines coming to Grenada?
The vaccines currently being considered by CARICOM or OECS right now, mainly AstraZeneca. There are discussions with respect to Sinopharm, the Chinese vaccine, Sputnik 5, the Russian vaccine, and Johnson & Johnson. With respect to the Johnson & Johnson, it is a very late possible delivery, as late as July or August, which in our opinion is going to be too late for us to wait that long for it. So that is why we are focusing on AstraZeneca, which is right now to date the most widely used throughout the world. And we are looking at the Sinopharm and Russian vaccine because they are very close to being accepted by the WHO. We will not use any vaccine that is not approved by the WHO or one of the accredited agencies, which is CDC, Public Health Canada, UK NHS, and EMA of Europe.
Thank you. Nancy Maguire?
I just have a quick follow-up question as it relates to that.
No, go ahead.
What about the vaccine made in Cuba?
We don't have any indication of it being close to approval.
Being considered.
But if it is approved by WHO, most definitely we would look to access that as well. But to date, we don't have information of its imminent approval by WHO.
That's it, Rena?
Yes, that's it. Thank you.
All right. So Nancy Maguire, now colleagues, let me just remind you, if you're not asking a question, just mute your mic, please. Thank you. Nancy Maguire?
Yes, I wanted to know how many now, and when do you expect to get more? And just to go back to my other question, and also on that fund, you said that people keep donating. What uses are you making of those funds? Thank you.
Nancy, sorry, can you just repeat those questions for us? You broke up a bit. Just repeat for us, please. Thanks.
Okay, are you satisfied with the level of people that have taken the vaccines? How many vaccines do we have on the island? Are we expecting more? And for the fund that I was asking about that you said we continue to get donations, what are we using those funds for? Thanks. Did you get that?
Yes, we got that. With the respect to the
Okay.
vaccine uptake, no. We are not satisfied with the amount of people that have taken the vaccine. We have currently received 23,500 doses of the AstraZeneca, and we have, as I said, used 8,764 of those doses. We have another 40,000 doses of AstraZeneca to arrive within the next 2 or 3 weeks from Pan American Health Organization. That is the first shipment of the COVAX facility that will come not just to Grenada but to all of the OECS and CARICOM countries as well. So no, Nancy, I'm not happy with the uptake. I hope that you have taken your vaccine, and the offer and challenge was made to most of the media workers as well. So I'm hoping that not only have they taken it, but if they want, they can use this opportunity as well to speak to it that they have taken it and they are still alive and well and actually better protected from COVID-19. And on the fund, the donation fund has been used. Yes, the fund has been used, for instance, with the purchase of PPEs, as well as to help with promotion, public service announcements, etc., for COVID-19 in general.
Thank you, Nancy. Nisha, good morning.
Good morning, everyone. I have 3 questions. The first, in response to the concerns raised over the AstraZeneca suspension in European countries, CARPHA in a statement days ago noted that the version that we are getting in the region is not the same batch or the one that is being used in Europe. Can you explain what is the difference about this vaccine that insulates or protects from the concerns that are expressed by these countries? And can you also explain why AstraZeneca is making a vaccine that varies from those that are produced in the first world countries? That's the first question. My second question relates to the vaccines. Again, we're receiving from friendly countries. Can you speak to the arrangement between Grenada and those countries in terms of who is covering the cost for transporting the vaccines and any other associated cost? And can you speak to arrangements for redress should anyone suffer from adverse effects? And also, can you provide an update regarding the tests sent to CARPHA for the new variants? Thank you.
With respect to the AstraZeneca, where it is, or the doses or so, from the comments made from CARPHA, AstraZeneca COVID-19 vaccine is produced at 3 main plants in the world. There is one in the UK or Europe, there is one in India, and there is one in South Korea. The most recent sets of AstraZeneca vaccine that we got in here in Grenada and the Caribbean came from the plant in India. The plant in Europe is only selling to Europe, is not selling to anyone as yet because they can't meet their own demand. The plant in India and South Korea are the ones that are supplying the rest of the world because they have that capacity. So we do expect, for instance, to begin to receive as well from the plant in South Korea AstraZeneca vaccinations at the same time that we are getting from the plant in India. Transport, acquisition, transport, etc., it's all the responsibility of the receiving country. So as to whether we as we did most recently, OECS countries pooled their resources through the central bank and paid the $250,000 to bring that most recent shipment. The other shipments as well, yes, we will incur a cost of procurement and transport for that. The redress mechanism remains the same, not just for vaccines. It's not like we just showed up on the scene and became a Ministry of Health with hospitals, and so when vaccines came on the scene. There is a redress mechanism for anyone who suffers at the hands of any medical practitioner or any medication, and that remains the same.
Colleagues, anybody else with questions? Thank you.
Okay, Minister, the updates on the CAFA, the results from
Right.
CAFA on the new variants. You didn't answer that one.
Dr. Martin?
Did we receive the results?
Right. So far, the results that we have sent to CAFA indicate that we do not have the new variant in Grenada at this point. We're continuing to send, and we'll update you as soon as we're able to do so. I want to further add to the mechanism that Minister alluded to. Prior to COVID vaccines being on the scene, we have a mechanism here called the SAVI mechanism, which is established to deal with and record adverse effects from vaccines. It is the same mechanism that we're using. So I encourage anyone who thinks that they have any issues related to the vaccine, you can report it, and there is an existing mechanism for dealing with symptoms associated with vaccine immunization.
Thank you. Anybody else, colleagues? GBN, you have another?
One question.
Go ahead. Go ahead.
Are there systems in place to track the side effects of people receiving the vaccines in Grenada?
Like I say, I hope I understand the question, because systems in place to track side effects side effects are very common for many other things. You take an penicillin antibiotics and you get a rash on your hand. You simply report it to your doctor. He changes that. So there is really not a system in place for tracking a headache from a vaccine, for example, or a fever from a vaccine, for example. But if there are any serious side effects or adverse reactions, as I should call adverse reactions from taking of a vaccine, then yes, there is a system in place for that. It's called a SAVI system, where it is documented, recorded, and submitted to the competent authorities to manage the outcome of it, both clinically and otherwise, in the event of a serious matter associated with vaccine immunization.
Somebody was asking as well, Dr. Martin, in terms of explaining herd immunity in terms of the vaccination process.
Right. Herd immunity is a public health phenomena where we say if you vaccinate enough of a certain population, then there will not be enough people with the virus to be able to successfully spread that virus around your community. And let's use your church community for an example. If your church has 25 people inside that church and 23 of them get vaccinated, the 2 people who are not vaccinated most likely will never get that virus, because for that virus to get to them, it has to go through those who are vaccinated. And obviously, it would not go through those who are vaccinated. So that 2 persons may not get that virus. However, if that 2 persons from your church go home in the community and get the virus and goes back to church with it, that person will not be able to spread that virus to nobody else in the church, so that because they are vaccinated. So herd immunity is a phenomenon that is used to prevent a second pandemic from happening. It prevents a second epidemic from happening. It prevents a second wave from happening. It doesn't mean that no one will never get the virus. Someone may get it, but that person will not be able to spread it to nobody else and preventing a second wave from happening. And that's how herd immunity actually works.
Yeah, and if I can add to that, the right now, to the best of our knowledge, we have no active cases of COVID-19 outside of the 2 persons that we have in quarantine. And as a result, we know that for COVID-19 to re-enter here, it has to come through from outside. And as such, the individuals involved in hospitality and meeting and greeting and interacting with persons coming from outside, if they are not fully vaccinated, then the herd immunity fails right there. And they take it onto the bus, and the bus driver and the conductor not being vaccinated, he takes it and he passes it on to everybody. But if everyone in a hospitality sector working there, if they are all vaccinated and someone comes in with COVID-19, they're all vaccinated. So they begin that process of protecting us, and they can leave the hotel and go home at the end of the day because they are vaccinated, and the first person that they interact with would be the bus driver, and he is vaccinated as well. And therefore the rest of us are protected. It just matters how quickly the person coming in can interact with a non-vaccinated person. And the more people we put around that person, that more people we put that are vaccinated, the better protected. And that is why I am raising the question as to while we each and every one of us has a right to take the vaccine or not to take the vaccine, do we still have a right to work in a frontline job, not take the vaccine and put the entire nation at risk?
That's a very powerful example, Minister. I love it.
Nisha, you have another question?
Yes, please. As it relates to the test center CAFA, you said currently we have we don't have the new variant. Can you speak to how many was sent and how many are we waiting on, if any?
I don't have a report on this as yet. We would really like to get it to you as soon as we can reach our Chief Medical Officer.
Thank you, sir.
All right, GBN, you have another question?
No.
Linda, good morning. You have another question?
Yes, I do. Yes, I do. Thanks for taking. Would the minister or Dr. Martin explain whether or not non-nationals, especially persons on yachts, boats, who are living on boats and would have been in Grenada for a long time, are allowed to be vaccinated here? I know that there's an issue where we have to bring our ID, but is there a special provision made for persons who are on boats and been here for a while, because some people actually live on boats for a very, very long time? My other question, for clarity purposes and for persons who are probably not aware, could Dr. Martin explain when someone in Grenada is tested positive, what is it that they're looking for? Is it the original thing, or there is some other guidance that now we're hearing of all this variant? What is it that we have identified in Grenada to confirm this is COVID? Because I think that's a question a lot of people want to know, because they're hearing so much about variant. So can we explain, when someone in Grenada is diagnosed, is it the original virus that is looked for, or something else that is identified to say, yes, this is the coronavirus that is in the Caribbean? Can Minister Steele share with us the amount of money that has been collected into the funds, and if possible, share with us the amount of money Grenada has benefited from, whether it is to buy PPP or other adjustment in terms of relating to COVID? Anything, funds as it pertains to COVID? Thanks.
Well, Linda, on your first question with respect to individuals who may be living on yachts, visiting here or here for an extended period, let me answer it this way. This government, like any other government, has an obligation to make available vaccines to its nationals and residents of its country. And therefore, you will see, as with most other nations that are implementing already a vaccination policy, that you make sure that your high risk individuals get access to the vaccine first, and then you keep moving down. And that, like the UK has said as well, that anyone residing in the UK will eventually have access to the vaccine. We do believe as well that anyone residing in Grenada should have access to the vaccine, but we need to make sure initially that we have our frontline, 65 and over, our citizens, and then anyone else. Now, some individuals who are non-Grenadians have already received the vaccines by virtue of where they are working or so, whether they're in the front line as well, legally here in Grenada working in the front line. So they most definitely would have been given access to the vaccine. Similarly, I am very much aware of Grenadians in the United States and the UK who are still Grenadian citizens but have had access to the vaccine in the US and in the UK by virtue of where they are working, or that they have a pre-existing condition or so that puts them at risk, and therefore are in that first line. Because of the number of vaccines that we have been able to get access to, and I'll be honest, because of the slow uptake from some of the front line that we wanted to give preference to in the beginning, we have said that everyone can come. Grenadian citizens and residents of Grenada can come to receive the vaccine now, because we are not seeing that line long enough that it's preventing them from getting the vaccine, but that we would give priority to frontline and over 65, so they won't have to stand in line. They can go immediately to registration and get the vaccine. So that is the answer there. With respect to the total amount received in donations, no, I do not have that figure, because there is a donation account where people can directly, privately and personally make deposits to that donation account for COVID-19. There have been donor countries and other entities that have given. The World Bank is one. St. George's University constantly and consistently has been assisting and giving. CDB, our central bank, etc. So there have been donations and assistance coming from various areas. I can say, though, that while it has been significant and it has really made a positive difference, there's still a lot more that needs to be done.
In response to the other medical aspects of the questions that she asked, how do we know it's the virus? Viruses are shapes, and that's a very important thing to understand. HIV virus has a certain shape. The common cold virus has a certain shape. Influenza has a certain shape. And COVID has a certain shape. That's how we know it's a COVID virus. And what the body recognizes on that shape is the protein spikes on it. And that protein spikes is what our immune system latches onto, or that protein spikes is what the virus uses to latch itself onto our cells for us to become infected. The reverse transcriptive PCR test that we do, it tests for the virus itself. It doesn't test for the shape. So it looks to see if the genetic material is that of COVID, but it doesn't say what the shape is. So in other words, we will always know when the virus is here, because it tests the genetic material. Now the variations, what caused the variations? The variations are caused because the protein spikes start getting different. And that's how you know is a variant. So for that reason, our lab in Grenada is unable to test the variant, because we do not test the protein spikes. All we test is the genetic material that is made up of the COVID. And that's the reason we need to send it to CARPHA to determine whether it's the variant or not. Now, what determines whether we send it to CARPHA? A few things determine that. First of all, the epidemiology and the surveillance. If that person is coming from a high-risk area, if we have good suspicion that that person is coming from an area that we suspect the variant is widespread, then we use that to send it to CARFA. Secondly, we looked at the individual themselves to see how they're behaving. Is there something different in their symptomatology? Are they behaving different? Is anything that is different around them and raises a suspicion that it could be a variant, then we send it to CARFA. And thirdly, as a responsible lab, there would be routine times you send it to your reference lab, which CARFA is referred to as a reference lab. In other words, it's a lab that ensures that our lab is doing the right test and is functioning well. Through normal process and quality control, you would normally send this to CARFA periodically anyway. And CARFA, of course, would test to see all the various variants. So I hope this was able to explain the question to Linda.
Thank you very much. Gentlemen, somebody's asking on social media, are returning nationals who have been vaccinated still required to quarantine even after presenting evidence that they would have been vaccinated?
Yeah, well, I think that's an excellent question, and 2 thumbs up there. I think it's very close, within days or weeks, where we would, and many other countries would, begin to see that a fully vaccinated person either does not need to quarantine or has a significantly reduced quarantine period. I think that's a given, that's a definite, that will happen. And it is my hope that it can possibly happen within the next week or 2, that we can begin to see that, and let me repeat myself, that a fully vaccinated person either does not have to go through quarantine or would be going through a significantly reduced quarantine period. Fully vaccinated. Remember, all of you who are waiting to see, it's going to be 14 weeks before you can get to that if you haven't yet had your first dose. Some of the other questions that we would need to determine as a ministry is which vaccine being fully vaccinated with. So to accept, there are certain vaccines that the WHO now accepts. So we would most definitely, at the beginning, say that those vaccines, if somebody is fully vaccinated with AstraZeneca, with Pfizer, with Moderna, then you don't need to, or will have a significantly reduced quarantine period when coming into Grenada. Not planning to go get vaccinated, but fully vaccinated, then you will not. But if you are not fully vaccinated, that you would have to go through the quarantine period because you are still at risk of getting and therefore spreading COVID-19.
Thank you very much, Minister. Colleagues, anybody else with questions? Nobody else? Linda, you have another one?
Yes. Yes. Minister, in St. Vincent, I know that our Prime Minister said no formal carnival. However, in St. Vincent, the Prime Minister there has said that if they're able to reach a certain amount, I think 70 to 80% of the population to be vaccinated by May, then there will be carnival. Is Grenada also, is that a discussion taking place within our cabinet? And if not, what the Prime Minister did say that there should be a meeting with stakeholders. What is the plan in going forward with regard to carnival or celebratory events during August?
Linda, we have said, and almost every country has said, that if they can get to 80% of their population vaccinated, then we can get back to life. The only reason that we said that Carnival is cancelled or postponed this year is because we're not at that level as yet. There is still a significant risk. But if we take an active role in slowing our vaccinations, then as public, we are taking an active role in delaying us getting back to life, in delaying when we can possibly have carnival. So it goes hand in hand. We would love to be able to say that 80% of the population is vaccinated and therefore we can go back to life. If that happens in June, then it is a valid question with respect to carnival or so. But at the current rate, where people are consistently telling us, I'll take the vaccine, I just want to wait a while. Well, wait. We will see St. Vincent, because they don't seem to be adopting that policy, we will see them with their Vinci Mass. And we will be missing out our Spice Mass. So we need to actively want to get back to life, a normal life. We need to be actively wanting to get past COVID-19, that COVID-19 is no longer a discussion here in post-cabinet. I have spent way too much time on post-cabinet briefing discussing COVID-19 when there are so many other things that are important to the nation that we should also be discussing as well. And those are the things that we are delaying when we as a public are saying that it is okay for a frontline worker not to be vaccinated, that it is okay for a hospitality sector worker not to be vaccinated and continue to put us at risk. And then to be asked, what about carnival? Well, you are the ones that are not applying the necessary pressure to your peers and allowing us or preventing us from having that discussion about carnival. Because we cannot have a discussion about carnival without having a discussion about 80% vaccination of the nation. So if you want to have a discussion about carnival, let us have a discussion about 80% vaccination of the nation.
In other words, if every jab take their jab, we go have jab.
All right, colleagues, anybody else with questions?
Yeah, just one quick question. P.S. Martin, regarding my question as it relates to the side effects and the records or the systems in place, could you tell me who exactly is taking the reports as it relates to the severe side effects?
Yes.
And would it be made public, for example, on a website, like how other countries have been displaying this?
Yes, you start very simply with your healthcare provider. That's where your access, that's where you engage met the system. So you would speak with your nurse in your geographical area where you are. And that's where once you access it there, she takes all your information, she put it into the SAVIs, and then we process it from there.
Let me just add that with respect to making any information public on side effects or severe side effects of vaccines, in the same way that we are obligated to report every single case of COVID-19, that is the same mechanism, same rules, etc., that we are obligated to report any adverse side effects or death from COVID-19. There will be no attempt to cover that up in the same way there's been no attempt to cover up the number of cases that we have of COVID-19. There is a mechanism. As Dr. Martin says, you speak to your healthcare provider or communicate to your healthcare provider. If someone has adverse effects, they would end up in hospital or to their doctor or so. There's an obligation to report there. And there are telephone numbers, and so if you look at the ministry's website, there are numbers to report any issues related to COVID-19, which also includes adverse side effects from the COVID-19 vaccination.
Colleagues, we are approaching the 1 hour mark. Anybody else has a quick question y'all want to get in before we wrap things up?
Yes, I want to ask my final question. Minister, we have been in the 12 to 4 a.m. curfew for the longest while. Is there any consideration to remove that curfew, so we can operate how we. There was a time we was in a state of emergency, but there was no curfew, so people was moving freely. Is that under consideration to be done shortly?
I think, Linda, the curfew is there because of the risk. We said that it was continuing because COVID-19 exists in all of our neighboring countries right now. And it is so easy for it to enter, as we saw in December, that frontline individuals were exposed, and them not being vaccinated meant immediately that it spread into the communities. So out of an abundance of caution and in recognition that COVID-19 spreads significantly through social activity and socializing, that we've maintained that curfew. But again, I think the public can demand and expect the removal of the curfew in this, because the risk would have been reduced nationally through vaccination. But again, the slow uptake on vaccination allows us still to have all of these other aspects that are not comfortable. The wearing of the mask, the limits on social gathering, the curfew, the travel restrictions. All of these things we want to get past. And all of these things, not just us, but every single country in the world is saying, we'll get past it through vaccination. And the countries that will get past it first are the countries that get 80% of their population vaccinated. So, Linda, everything now harps on vaccination. Curfew, carnival, travel, masks, restrictions on social gathering, all of these aspects that have created so much discomfort has resulted in loss of jobs for individuals. We can get past and need to get past and have to get past it. And that is through vaccination.
All right, colleagues, final call. We are approaching 11 o'clock. Anybody else with a final question? No? All right, so we'll wrap things up here. Dr. Martin, any final words from you, and then we'll have the minister have the final words.
As usual, I would like to encourage people to take care of themselves. In this pandemic situation, we recognize the importance of having a strong immune system. I've always advocate for us to drink lots of water, sleep, rest as much as you can, eat lots of lots of bright colored foods, and in this particular instance, because of the vaccination, we want you to have good protein so that your immune system can really build nice antibodies for the vaccine. So I encourage all of you to go get the vaccine, but in so doing, ensure that you eat your bright colored foods. You must have good proteins in your body, so we recommend that you do lots of fish protein and egg as well. It's important. Those two proteins are very critical for the formation of antibodies. So as you go to get your vaccine, make sure you do this, and your immune system is going to really kick in a really nice protection for you. All the best to everyone.
Thank you. Minister?
Well, 3 words: vaccine, vaccine, vaccine. But I mean, I don't mean to make light of it, but it is so important for us to get past. We still are at a very significant risk of having COVID-19 enter Grenada. That risk significantly is reduced as we get more and more individuals vaccinated. If we can get ourselves into the situation where, because there'll still be COVID-19 outside, but if we were to get to the situation where the person who comes in with COVID-19 interacts with vaccinated Grenadians, then we're home free. We're able to say, let's open up. We're able to put all of the various restrictions behind us. And we, as a government, have given the people the choice. It is for the people to decide how quickly we would like to put COVID-19 behind us. The choice is yours. You decide how quickly You want to get back to normal. You want to get to carnival. You want to get to travel. You want to get the businesses to open fully. You want to get to party. You want to get rid of the curfew. You decide. We have made the vaccines available. None of our facilities have been put under stress where we don't have enough people to give the vaccines. We don't have enough people coming to get the vaccines. And if that continues, we will see all of our Caribbean nations go past, and the rest of the world go past us. And we will be stuck here in this current status quo with the curfew, with the restrictions on gathering, with the wearing of the masks, with certain businesses not being able to operate, certain businesses only being able to operate at minimal numbers. And we'll see everybody else moving forward. The choice is yours. You decide how quickly we get past COVID-19.
Thank you, Honorable Minister Nicholas Steele. So, colleagues, thank you so much. Of course, we've been dealing with COVID-19 update, Ministry of Health this morning. So we say thank you to the Honorable Minister for Health and Social Security, Nicholas Steele, and of course, Dr. Francis Martin, the Acting Permanent Secretary in the Ministry as well. And to all our colleagues who joined us via Zoom, the viewers on Channel 22 of Facebook page and the YouTube channel as well, we say thank you so much. Have a blessed day, everybody.